I chose this topic because recently my family had a loss due to AIDS. My uncle was a long-time intravenous drug user and was diagnosed with HIV 8 months ago, and he died about 2 months ago from full-blown AIDS. And it was something that I never really thought would happen to me or my family. I knew it was out there, and he was at really high risk, but it was something that really, really hit me hard. And since then, I've kind of been on the quest for as much information as I can find about it. In doing this research for this project, I found that my age group, which is 13 to 29, is at the highest rate for new infections every year at 34%. So that was also something that really hit me. That's all my friends, the people I know, my classmates, my colleagues, things like that. So I definitely have been on a full-blown, let's find out as much as we can. So we'll start from the beginning. HIV is a virus, human immunodeficiency virus. It is the virus that causes AIDS. 50,000 people each year are infected with HIV in America. Currently, 1.2 million people in the U.S. live with HIV, and 1 in 5 people don't know it. So I know that HIV is obviously a worldwide problem, but I decided to focus on San Francisco. From the beginning, San Francisco has been in the spotlight with the HIV/AIDS epidemic, with the first cases in the 80s being found here in some gay men living here in San Francisco. Currently, 15,800 people in San Francisco live with HIV, and every year people are reported of having. Every year, the CDC reports on the numbers that San Francisco new infection rate. Last year was 399 new infections in San Francisco, which was down from 480 in 2010. So it's kind of showing that the awareness is having an effect. When HIV first started becoming a problem, the CDC named it GRID, which was gay-related immunodeficiency, and assigning a deadly, somewhat unknown disease to a group of people stigmatized gay men specifically, and allowed them to be victims of social violence as well as sometimes physical violence. And since then, obviously, we're more aware that it happens to everybody. It can happen to anybody. So that's something that has become, with awareness and with the information that we've learned. So this is a picture that I really, really liked. I moved to San Francisco 3 years ago from school. This is City Hall on World AIDS Day, which is December 1st. And it just shows that here HIV and AIDS doesn't really run in the rut, that it is known, everybody knows about it, and we try our hardest to make everybody as aware as possible. So these are some pictures that I took myself. This is kind of what got me sparked on the idea of awareness here. These are in the Castro and Church Muni stations. I don't know if everybody takes Muni or not, but if you do, you pass these every day. These are 2 ads for, one is for a side effect of HIV medication, and one is just an awareness about being tested. And the next slide too is just another way of showing, every day everybody takes Muni, you walk past it, even if you don't think you're at risk, you see it every day and you kind of think about it, and it's just another way of getting that awareness into everybody's head. So my main point is about prevention versus treatment. Obviously, you want to prevent something rather than treat it. It's easier that way, and you're not sick that way. So one of the preventive methods I really like is a program called Family Pact. Family Pact is a California state program run by the California Department of Public Health. It's a free sexual health program that's available for men and women as well as teenagers. Most everybody applies under the program, and it provides free testing, free birth control, education, counseling, and treatment. State, our health center partners with Family Pact. You get a free part of it here or at Planned Parenthood. This is really important because the United States doesn't have a mandated sexual health education program nationwide. Only 30 out of 50 states in the United States don't have mandated sexual health in schools, and 15 out of 20 that do stress abstinence. So programs like this provide a resource for school on Google Maps. There are 20 clinics, I think, and over 20 clinics in our 49 square miles. Most of them are anonymous and free and allow for people to have resources to know your status. The most important thing you can do is keep yourself safe. And most of these clinics are paired with family packs, so you can also get education, information, and treatment. This is a map of free needle exchanges in San Francisco. Needle exchange is a program to prevent sharing needles between intermediate drug users. Mostly it promotes safety rather than drug use, and it's a pretty hot topic when it comes up because people always think that needle exchanges promote drug use rather than safety. The United States has a syringe exchange program that did a survey, and 13 out of 54 states and territories, including Guam, Puerto Rico, and the Virgin Islands, have no needle exchanges. And needle exchange in San Francisco is obviously, important. We have a lot of them, and it's a very important way of preventing HIV transmission between intermediate drug users. So it's very important to remember that people that are infected with HIV are still human beings. They're still entitled to all the rights that everyone else is. And in our class we learned about the Universal Declaration of Human Rights. And I picked two articles I thought pertain to HIV and awareness. And one of them is Article 7, which is about discrimination. All are equal before the law and are entitled without any discrimination to equal protection of the law. All are entitled to equal protection against any discrimination in violation of this declaration and against any incitement to such discrimination. People that are HIV positive, not only in the United States, but in the whole world, face a major stigma that makes life harder for them to cope with their disease. And I feel like the Bay Area provides the awareness for people to know what's happening, to know that, if you share a glass with somebody who's HIV positive, you're not going to get it. And then the second article is Article 26, Section 2, which is about education. Education shall be directed to the full development of human personality and the strengthening of respect for human rights and fundamental freedoms. It shall promote understanding, tolerance, and friendship among all nations, racial or religious groups, and shall further the activities of the United Nations for the maintenance of peace. Obviously, sex education is really important when keeping yourself safe, because the most important thing you can do is to keep yourself safe and keep others safe by doing that. So, call to action. Like I said, I've been on this goal to tell everybody I know about as much as I know. I take the AIDS Modern Epidemic class here at school, so I've learned a lot doing that. And doing this project, I've talked to a lot of my friends about what they think their risk is, because our age group is the highest for new infection. And a lot of my friends that engaged in risky behavior thought, it's never going to happen to me, and I'm healthy, and I know the people, and that's fine. But then I showed them things like this, which is a chart about sexual exposure, which is kind of shocking. But, that person didn't think it was going to happen to them. That person didn't think it was going to happen to them. And that's how things get spread. And you really have to keep yourself, main thing, keep yourself safe. And that keeps everyone safe. You can actually skip the next slide. So a few things specifically in San Francisco that you can do to support the cause of HIV awareness. One of my favorites is Out of the Closet. It's a thrift store that's paired with the AIDS Healthcare Foundation. It's a nonprofit, and all their proceeds go toward the AIDS Healthcare Foundation to promote research, education, and prevention. Every Out of the Closet is paired with a clinic or pharmacy that you can get free testing, and you get free condoms. So you get about 3 condoms, as many as you want. A nationwide campaign that I really liked is called Be the Generation. It's actually a government-funded program about to be the generation to come up with an HIV vaccine and to completely, HIV is completely preventable, and to be the generation to stop it. On their on their website, the main thing they say about getting involved is to keep yourself safe. That's the one thing sure that everybody know, you give them all the information that you know. It's something that is important, and it shouldn't be stigmatized or taboo, that it is an important thing. Also the AIDS walk. 39 out of 50 U.S. states have AIDS walks. Ours in San Francisco is July 15th. And it's a good way for the community to get involved, for people to walk. People, you know, they give information and they raise money. It's a community walk. This is a worldwide campaign called it's called the No Campaign, but their statement is very, very bold and moving. We all have AIDS if one of us does. This, you know, we're all human beings, like I said, and we all have the same rights. And if somebody's rights are violated, our rights are violated. And the most important thing, too, is that, like I've been stressing, keep yourself safe,